Hello, everyone. Welcome to our San Mateo County, Silicon Valley CVB webinar. Folks are coming in through the waiting room, so we'll give it a few moments. Happy Thursday. Hope everyone is doing well. Thank you for being here. Hello, everyone. Welcome to our San Mateo County, Silicon Valley CVB webinar. Glad everyone could join. Lots of attendees today. We'll give it just another minute or so as folks are coming through the waiting room. Oh, everyone's punctual today. That's so nice. Thank you. We'll give it one more minute. Again, welcome. Happy Thursday, December 17th. Again, welcome to our CVB webinar. And we'll give it just 30 more seconds. Kick it off right at 10 o'clock. Thank you all for being so punctual. Well, terrific. Again, good morning, and thank you for joining the San Mateo County Silicon Valley Convention and Visitors Bureau webinar. Today's topic, COVID operational compliance for businesses. Quite timely, as yesterday an announcement was made that the Greater Bay Area will flip into the more restricted shelter-at-home order of the state of California at 11:59 p.m. This evening, so right as midnight approaches. There must be something in the air. I got that time wrong on the newsletter yesterday. We issued a correction. I apologize, and I just had a verbal flub there. So at midnight tonight, that order goes into effect. I'm happy to report, we take these little victories in life when we get them. The jacket I'm wearing, I have not worn since the first shelter order went in place in March. I looked at it this morning, moment of truth, happy to report it fits. I was able to button it up, top button works. We are good to go. So with that, hello everyone, I'm John Hutar, President and CEO of our San Mateo County Silicon Valley Convention and Visitors Bureau. Welcome to our virtual partner event. This year has been a whirlwind, and we have really appreciated those of you who have continued to support our organization. We know the COVID crisis has been frustrating, scary, and confusing for all of us, especially as business owners trying to navigate the ever-changing landscape of COVID restrictions. Today, we hope to shed some light on your questions, and the speaker couldn't be more timely with this new shelter order coming into place. We know your time is valuable, and we appreciate you being here today and participating with us. A few housekeeping notes. We will record this session and make it available to those who are unable to join right now. We ask you to please ask your questions via the chat to everyone, and we'll do our best to get through all of them. So with that, it is my pleasure to introduce our guest speaker, Wayne Haas, Business Compliance Unit Supervisor for San Mateo County. Wayne joined the San Mateo Police Department in 1986. He worked through the ranks and eventually became captain during his 28 years of service. Wayne retired in 2015 and was hired by the County Office of Emergency Services to manage the installation of a Bay Area emergency communication system in coordination with 6 other counties in preparation for Super Bowl 50. In October 2020, Wayne returned full-time to San Mateo County as supervisor of the newly created COVID-19 Business Compliance Unit under the Environmental Health Department. His team of 8 former police and firefighters respond daily to online complaints of violations of the county and state health officers' COVID-19 orders. COVID-19 Business Compliance Unit is a temporary team that is federally funded under the Coronavirus Relief Act. So with that, my pleasure to introduce you, Wayne. Welcome here today. The timing of this webinar couldn't be better given what happens in a few short hours this evening. The floor is yours. Take it away and let us know when you'd like to advance the slides.
Absolutely. Well, thank you, John, and thank you to the Convention and Visitors Bureau for inviting me. And sure enough, this could be no more timely than what I'm going to give you today. As I go through my presentation, the only thing that I ask is at the end, you ask your questions to me. As many as I can answer, I will. Just don't shoot the messenger. I'm not the health officer, but I'll walk you through kind of how we got to where we are. I'm going to talk a little bit about what our unit does and what we don't do, and why we're a temporary unit helping us get through this COVID-19 pandemic. Next slide, please. We were formed in October of 2020. I was called by the county manager, who also used to work for the San Mateo Police Department, so there's probably a tie there someplace. And he asked me to stand up a enforcement team. Gave me about 2 weeks notice and said, stand up as many people as you can that are willing to be temporary employees. So I went and sought all the folks that are first responders, folks that I knew that retired from San Mateo County and around the Bay Area that wanted to get off the couch and still come and help. So the way our team is divided, we work directly for the county manager's office. Our parent agency is environmental health. So from the county manager's office, we have a business engagement and compliance program that's split into 2 teams. Our first team is the engagement team. They're our pre-team that goes out. They are bilingual in multiple languages to include Chinese and Vietnamese, Spanish. And they go out to the businesses, primarily the minority-owned, low-income neighborhoods, and help them get through the pandemic, whether it be grants of what they need. But they're the folks that are out there working day-to-day with the business owners. Then my team comes in, and we respond to complaints primarily from the public. Go to the next slide. So the way that we get our complaints is twofold. One is the 211 system in San Mateo County. You can call and say that you're reporting a violation of what you believe is a COVID-19 prevention violation. That gets put into our web portal, which is on the county's website. You can also, anybody can go into the web portal and enter information that comes to my team. We determine if it falls within a business jurisdiction, and then we send folks out into the field. Our primary job is to work with the business to help them get to yes, to help them figure out how to these changes, different colors that I'll talk about. They're changing all the time, and it's very difficult to stay on top of. And so we're primarily working off of the health officer's order. In June 2020, Dr. Scott Morrow, who is the senior health officer in all of the state of California, he is also, and I'm proud to say, our health officer for San Mateo County. He wrote an order basically aligning the county with the state. Next slide. So his order on June 17th aligned San Mateo County with the state's order. So whatever the state was going to order medically, San Mateo County would follow suit, at least for a while we would. It requires social distancing and face covering as normally. And it also requires that you have a business plan that you is posted on your front door, and I'll talk about that, that has you go through with your employees and with your customers as they come in, so that they know what protocols and what precautions you've taken for your business. Next slide. So in August of this year, the County Board of Supervisors passed an emergency ordinance following after what Dr. Morrow did. And the ordinance specifically calls out for formation of the team that I work for. And again, that we're a temporary team until we're done with the COVID crisis, or at least until we have a majority of the population vaccinated. And I hope that we hit that point by spring of next year. So the state, obviously, for most of you will know, the state has several tiers of reopening. It's called their blueprint for reopening of society. And I'll talk a little bit about where the tiers are, where we are now, and where we're headed. Next slide, please. So you've all known the tiers, the yellow, orange, red, and purple. Tier 1 is the worst tier to be in, and unfortunately, we've gone to what we're now calling purple. I lost the name of it offhand, but
Deep purple, if I may.
deep purple. Thank you, John, because that's just something we made up yesterday. But what this spreadsheet does is it lets you as a business owner go through and say, okay, if we're in the red and we're a hotels and lodging, we can be open with modifications, and our fitness centers can be occupied up to 10%. We're now all in the purple. So this spreadsheet is pretty easy, and there's a hyperlink. We're going to send out this afterwards to everybody. All of these are hyperlinked to the state's webpage, and you can see their current tier outlines. But hotels and lodging, you're still open with some modifications. I'm going to talk at the very, very end about what the new modifications are that go into place tonight, because it's not good news that I'll be bringing you. Gyms and fitness centers have moved to outdoors only, and that is quite a chore for most of the fitness centers. Some have taken the stance that they're not going to move outdoors and that they're not going to abide with the state's health order. And that's now where my team comes in, and we're trying to work with some of these businesses to ensure that they, again, we get to yes, we move them outdoors safely. And otherwise, we do have the authority under the ordinance to issue administrative citations, and those can be pretty steep. The lowest amount is $250. It goes up to $3,000. So at $250, a business might say, it's the cost of doing business to stay open. I'll pay it, but I'm not going to go to purple. When it starts hitting $3,000 a day, it's no longer the cost of doing business. And again, we get down to the bottom of restaurants are outdoors only, and then effective tonight, they're going to be takeout only. Next slide, please. So a lot of time you'll see on the state list, what does open with modifications mean? And it is the common sense of you still need a social distance, you still need to wear a mask, you still need to have hand sanitizers available, you still need to have your postings. And your capacity, whether it being indoors or outdoors, is based on whatever you and the fire marshal have agreed is the occupancy for a particular building. So if you're a restaurant and you're 100, you can have 100 people inside, that's posted at the front door, then at 25%, we're obviously 25 people. Next slide, please. Talk a little bit about what our team has done since October 15th. We have no lack of complaints coming in. As of yesterday, we have investigated 747 businesses. We've actually been to all 747 businesses. And we're finding that most of the complaints we can abate just by educating the business, and that's what we want to do. We've issued 58 written warnings, and only of the 747, only had to do 5 administrative citations. And those are for businesses that have decided for whatever reason they're not going to comply with the state's health order. Most of our top 3 complaints are restaurants, retail shopping. Retail shopping tends to be for occupancy. It's great when you go into a Costco and they hold you at the door, but then once you get to the meat section, everybody's banging into each other. So we do get a lot of complaints about businesses that once people get inside, they still need to social distance. And then our number one climbing complaint is against gym and fitness centers, because they're really struggling trying to figure out how to move an entire gymnasium outdoors, and do they have that property available to them. And as we know, property is hard to get to, and parking is terrible in most of our businesses, and San Mateo County. So to move your business outdoors and then try to run the business is obviously very, very difficult. Next slide, please. So we shifted from red to purple about 3.5 weeks ago, and it moved all of our retail. They went from 50% occupancy to 25%. And I won't read through all these, but you can see what happens is a place of worship was 25% indoors, and now they're outdoors only. Movie theaters were 25%, now they're outdoors only. Well, that essentially closes most of the movie theaters. And schools, if the kids are in school now, they can continue to be in school under the purple tier. And we work directly with the County Office of Education. So as things change, we work with them directly. If we get complaints about schools, we pass them straight to the County Office of Education. Next slide. Restaurants have really had to adapt. Right now, we are, until midnight tonight, we are outside only with the modifications. And those modifications I talked about, but also a lot of restaurants like to have tents outside. The state requires that if you do have a tent, that you have at least 50% ventilation. So essentially, two sides, and we prefer them to be the opposite sides, need to be open so we get ventilation from the outside. If you want to have a fan to help blow some of that air through, that's wonderful. But also, when you do get this PowerPoint, if you're a restaurant listening today, there's a hyperlink for the restaurant guidance document. Each major type of business has a 8 to 10 page specifically addressed to your type of business rules that are on the state webpage. And so please do click on this afterwards, and I'll show you some of the resources. Everything that you're going to need to run your business, you're going to be able to find either on the county's website, the state's website, or frankly, just shoot me an email and I'll get you to where you need to go. Next slide. Bars, breweries, and distilleries. If you do not serve food, you're closed. When bars were open, we were not allowing anybody to sit at the bar itself because we could not maintain 6 feet distance from the staff behind the bar. So what the state did, which was kind of unique, is they decided if you're a bar and if you're going to serve meals, then you're no longer a bar, you're now a restaurant. So you follow the restaurant guidelines. So now if you're a bar and you've now started to serve hamburgers and hot dogs, you can move outside. And that's something that under the ABC laws, we've never been able to take beer and wine outside. You can actually get your beer to go, believe it or not. And they're trying to keep the businesses open the best we can. People are asking me all the time, well, what's magical about food in a bar? Is there something that keeps COVID away if you eat food? And the concept being that alcohol alone tends to get groups closer together. They tend to talk a lot more, and they tend to not want to wear their mask because they're drinking at the same time. People who have food don't necessarily want you right on top of their food. So if you're serving food, they tend to social distance. And that was the concept that the state came up with. I can't tell you honestly how effective that has been, but that's at least the rules to keep these bars, breweries, and distilleries open. The same also applies to wineries. Next slide, please. This, I think, personally has been the most difficult to work with. These gymnasiums, you know, the top left-hand picture shows a typical indoor gymnasium as we'd like to see it. Unfortunately, they've had to move outdoors, and the picture in the middle was a little video we had shot trying to show how one of our local fitness centers in San Mateo is trying to work within a multi-story parking garage. And this took us a while to figure out, was this like a tent? Did this have 50% ventilation? And our job is to figure out how to get to yes. And I'll say that a lot because that's why I came out of retirement, was to help businesses, not be the iron fist on businesses. So we spent about a week working with some experts and said, this is sufficient. There's enough airflow coming between here. We asked them that they move their equipment 12 feet apart instead of 6 feet apart. And please wear masks while you're outdoors. We will still continue to work with the fitness centers. If you're a hotel and you have a fitness center inside, you need to either close it or you need to move it outside. And that's totally up to you on what position you wish to take. But at inside, you were only at 10% occupancy anyway. So in most of your businesses, you probably only had one person working at a time. If you choose to move that furniture outside, most hotels I'm showing just have choose to close the doors for right now on their fitness centers. And there's also a specific regulation for indoor pools. Indoor pools were allowed, and then there was a stop. And I believe today indoor pools are still allowed, but there's a 10% requirement. And again, a lot of people that have indoor pools may want to close them during the next couple of weeks. Next slide. So let me show you some required postings. This is, as John said, this is my low-hanging fruit. This is what we really work on first for every business. There are postings that you need to have, and there are things you need to work through with both your customers and your employees. Next slide. So this is your health and safety plan. This is literally a plan that you work with your employees. And I'll show you where you can find all of these forms afterwards on our website. But the left-hand checklist is a checklist to go through with you and your employees. I recommend that all new employees are required to read this, but then you sit down with your employees and you say, these are the requirements. You post this where you would normally post your Cal OSHA paperwork. This does not need to be posted in view of the public. And then there's a checklist on the right-hand side where you go through and you literally say, what's going to be our schedule for cleaning restrooms? What's going to be, where do we find PPEs? And it's a place where employees can go and say, I need some new gloves, where the PPE is stored. It should be on your checklist here. Next slide. So again, when you go through your health and safety plan, this is an internal document just for you. It talks a lot about sanitation, physical distancing. One of the complaints that I get a fair amount are from employees, and they're saying, I'm at work and people at my job have tested positive and they're still at work, or nobody's being screened when they get to work by my employer and I don't feel safe here anymore. That's a really difficult case for us to investigate because we do not share with who reported to us. So but some of these by definition are clearly an employee. So we talk to the businesses and say, you clearly have some concerns with your employees. Please sit down, go over this checklist again. And then feel free to have your employees have an internal discussion or call us if they have some additional questions. Next slide. And this was also part of the social distancing protocol, was a protocol in which you are going to post on the front of your door. It's the appendix to the June 17th order from the state, and it's pretty self-explanatory. Next slide. This is the one that we look to have on all doors, which we know you've done the other paperwork. This is the I'm prepared for COVID-19. At the bottom of this form is, who do you call? This is what you post on your front door of all your businesses. If you're an employee or an employer or a customer, who do you call if you have a concern? And it can simply be the local police department, 211, or my department, San Mateo County Health Department. And it just lets people know that you've gone through this step and it's who they can call. This is the first thing that we look for, and we hand out these when we come to the businesses if you don't have them. Next slide. This is actually a slide that I like this picture more than any. Picture's worth 1,000 words. This is something that we recommend that you post several places in your restrooms, at your front door. It talks again about how important social distancing is, washing your hands. We've had washing your hands signs in our restrooms for a decade. Now we really need people to ensure that they wash their hands. Next slide, please. All of these forms that I just talked about can be found in multiple languages, and they're on the smchealth.org/EH, which is for environmental health. That will take you to all the frequently asked questions about specific businesses. It then passes you on to the state guidelines. And if you have any questions at all, please come to our website. You'll see our contact information on, but every form I just talked about is downloadable. You can fill it out as a PDF, print it, stick it on your doors. Takes about a half an hour, but it's the documents that you must have under the state and the county's requirements. Next slide. And now for the bad news. As you all know, or if you haven't been watching the news, the San Mateo County has been fighting. We're all in purple. We've been fighting the stay-at-home order. We're in a group of 6 regional counties. 5 of the 6 decided 3 weeks ago that they were going to do social distancing before the state required it. Dr. Morrow objected to that and felt that it was not ready, that ICU beds alone was not enough of a number, enough of a matrix for him to close. So for the last 2.5 weeks, we have not been under the stay-at-home order. We're the only county in the Bay Area that hasn't been. Unfortunately, our ICU beds dropped so low yesterday and early on this week, we're down to about 10%. So Dr. Morrow agreed that we would then comply. If you look at some of the different business, look at what works for you as far as the type of business you have. The one I want to point out, because I think most of you are hotel operators. Again, this takes effect at midnight tonight. It's allowed for COVID mitigation and containment measures, treatment measures, provide accommodations for essential workers, or provide housing solutions, including measurements to protect homeless populations. I recommend you go to the state website and you look at a greater, and we'll probably have some questions on this, but a much greater explanation of this. It essentially says, effective at midnight tonight, you shouldn't be taking any in-state reservations from here for the next, until we're in the stay-at-home order ends, unless they are essential workers or they're here to work on. Essential workers can be anything from grocery store operators to first responders. But I'll probably wait because I think we'll have a lot of questions on that. Go to the next slide, please. Oh, good. Well, it's good time for questions anyway. So thank you. I'm sorry if I went very, very quick because I knew I wanted to save a lot of time for some questions and answers, should we have them, especially about reservation systems. And I'll turn it back to John.
Well, thank you so much, Wayne. And if you are looking for your 4th, 5th, or 6th act after retirement, I think voice over web hosting might be in your
thank you.
Career future. Beautiful voice.
Thank you.
A couple of questions have come in the chat. And one is, yes, we will have a copy of the slides available afterwards. It'll be sent out along with the recording. Next question, Wayne, do you have an app or method of implementing entrance metering for patients? So I guess that would be, some garages have it where they car count. Does anything like that exist that you're aware of? Or
I've seen a couple of different, there's some iPhone, Android apps that you can connect within your business. I think Home Depot has something similar, that somebody stands at the front entrance and somebody stands at the rear, and one says, okay, person in, and then one says person out, and they have a running total. What I'm seeing though on Amazon is folks are just buying simple clickers. They know what their maximum is, and they have somebody either on a phone or a radio at their exit if the exit's not at the same place at their entrance, and they're literally counting people in, counting people out.
Terrific. Next question. Originally, we were told local law enforcement agencies were the public contact for complaints. Should all complaints, whether in cities or unincorporated, now be referred to your office? Yes,
kind of. So the yes part is, we were brought in because local law enforcement just couldn't keep up on the amount of complaints that were coming in. So we were stood up to supplement them. We do supplement local law enforcement. We are allowed under this ordinance to enforce it anywhere in any city and in the unincorporated areas. So what we do is if we are working in a particular city or we have a lot of complaints in a city, I reach out to the local police chief and ask them if they want to work with us. But at nighttime, our folks are generally out until about 9 o'clock at night. And we do try to cover 7 days a week when at all possible. Feel free to call your local law enforcement if it's something you were looking for a response right now. If it's not, call 211 or go to the San Mateo County's main webpage, and you'll see right on the front webpage about how to report online. That comes to us. Any of those methods are fine. Yeah, but if it's going to be late at night, I ask you to call your local police department. Otherwise, bring them to us, and it's my job to coordinate with the police departments.
Terrific. And, we talked about a little bit this in rehearsal. Police resources are valuable, and bad things continue to happen even in a pandemic. Unfortunately, really, really bad things. So to the extent that they can be directed to COVID compliance, I think just as a societal issue, but obviously if it's egregious behavior and urgent, it's always good to have that local immediate resource.
Absolutely. Plus, we're trying to come in not just as that hammer. We're trying to come in and help people figure out how to get through all the rules. It's only when we have to go back 3 or 4 times to a business because they're not agreeing with the rules do we then go towards administrative citations.
What qualifies as outdoor recreation for the new order? And I assume that means Deep Purple, that
Yep.
isn't the rock band of my generation, but the order coming tonight.
So essentially, outdoor, it's if you're with anyone else, both of you are required to wear masks. So if you're going for a jog with somebody else, you're both required to wear masks. If you're alone, you still don't need to wear a mask. But as far as outdoor, we just ask that you still wear a mask when you're out. You say if you bring 2 treadmills outside, we ask that you spread them a little more than 6 feet apart because we are expelling a lot of air when we're working out. And one of the hardest things that we're struggling with as a team, physical health is one of the ways that you combat COVID-19. So we want to do everything to keep our community in physical health as we're battling through the cold and the flu season.
Thank you. Can a hotel offer 1 or 2 live musicians more as ambiance, and not a concert, but as ambient music outside? Is this okay with no setup and dancing?
Not under the stay-at-home order. It's not. When you get back to normal purple, the way the states come down is if you're playing an instrument in which you blow air into it, that's not allowed. If you're playing a guitar, as long as you don't sing, that's okay. So you can have a piano player in the back, absolutely. We just ask the piano player if they're going to sing, they wear a mask. But we're trying to get them to, especially the wind instruments, we're trying to avoid those. So a guitar player in the back of an indoor restaurant would be certainly ambiance music, not the focal point of entertainment, because we don't want people to come to go, well, this is the greatest guitar player in the world. Let's all come and see this person, as opposed to we were planning on going to this restaurant tonight, and this just happened to be somebody playing in the background.
Terrific. So let's jump into this essential guest issue. The first question is, where can I find information related to the guests we can accommodate?
If you go to the San Mateo County health.org/EH page, we should have a pass through to the state page. If we don't have it on right now, we will definitely have it on by the end of the day, because I just saw a draft of what was going on out there. And I think I've even got the draft email that I can share real quick. If you want to ask the next question, I'll find this real quick because I had some good information on it.
Yeah, so on the San Mateo County site, it reads, allow for COVID-19 mitigation and containment measures, treatment measures, provide accommodation for essential workers, or providing housing solutions, including measures to protect homeless populations. And this is under the hotel
Right.
and lodging.
So
So,
what I'm saying is it says closed for in-state reservations unless for COVID-19 mitigation and containment measures, which I talked before, or to accommodate essential workers or those displaced as a result of fire or other emergency, or as a housing solution, or to include measures to protect the homeless. And it says open for non-essential out-of-state reservations as long as the reservations is at least the minimum time period for quarantine, which now the state has moved to 10 days. So as I read this, and there's a lot of interpretation here. As I read this, you could take an out-of-state reservation if they reserve for at least 10 days. They don't necessarily have to stay in your place for 10 days, but that's the reservation. I personally feel by the time we get there, we may be out of this deep purple. We're probably looking at mid to late January for going back out. But that's the current rules as I'm reading them. And I hope we get some clarification from the state today.
and Wayne, what you just cited is located where?
Well, it's currently located in my email. That's going to go on this. That's going to go on our webpage. That was language that was batted through the health team this morning to say, can we give some more the actual words? Can we give some more guidance because this is pretty generic?
Okay, so this is really timely.
This is real time.
We won't ask for the passcode to your computer, but we'll gladly get that information out when it becomes available.
And I will send to CVB this any new information, and then you can email it out through your normal lists.
So let's take this thread a little further. From your department's perspective, what questions would you ask of a hotel front desk operation as far as screening of who's essential, non-essential, and providing housing solutions? Like this is a bit overwhelming for the hotel operator.
Sure. So as a matter of just priorities right now, I do not envision my team coming to hotels and asking to look at your register or asking you to justify who's staying in what rooms. It's hard enough for you to keep track and then for us to try to figure out on top of that. What I would do is if you take any reservations, tell them that we're on a stay-at-home order. If they're coming, especially coming from out of state, they may not be aware of what stay-at-home orders are. And boy, will they be upset once they get here if they planned on, seeing some of our beautiful sites in the San Francisco Bay Area, only to find them all closed. So I would ask those questions at reservation time. Or if there's in part of your reservation forms, can you explain how you're essential worker, because that's all that that California is allowing right now.
Yeah, and it gets complicated very quickly because you don't want to be in the position of determining what qualifies as essential and what qualifies as necessary housing.
Right, because keep in mind, if somebody comes and just says, I don't have a place to stay tonight, well, that's essential housing. And
Yes.
if somebody else, comes and says, I need a place to stay for the next 10 days because for whatever reason, I can't go home. And a lot of hotels in our county did that during these different spikes. I know I've been staying in a local hotel when I come down, and they always screen me when I come in and ask those questions. Am I here on essential business?
And just curious, as a guest, do you find that, well, I'm sure from your work hat on, you find it appealing that they're taking that step. If you were not in your role, would you find that invasive, or how would you perceive that?
I think just for an informational standpoint, I mean, keep in mind, we don't write the regulations, we just have to enforce them, and you have to abide by them. So for that, I think as simple as the state is requiring us to ask these questions of you should be sufficient. And I don't think you're going to get a lot of pushback from your folks are going to be coming and staying in your hotels. But I do think the people coming from out of state would like to know that we're in a stay-at-home order, especially during this holiday season. And they can be grocery workers, but I don't think you need to necessarily ask what their occupation is or what makes them essential. I think you're getting so far in the weeds, and then we get different interpretations from different places that I hate to see you doing something different than your competition down the road's doing.
Yeah.
And having unfair competition.
Yeah, and I'll mention one more thing related to this. Our organization suspended marketing earlier in the month, wanting to do the right thing. And to my knowledge, there are no large hotel campaigns or convention campaigns or any of that going on. So suffice to say that people are, by and large, trying to do the right thing and be proactive, and we'll get the information you have when it becomes available out, and I'm sure everyone will find their way. Onto a different subject. Does a roaming beverage cart roaming around a resort offering to-go style drinks fall within purple restrictions, or must they also offer food? There might be a couple words missing here, so I'm reinterpreting, but if you have a beverage cart, would you have to offer food?
That's a very, very good question. The analogy I'm going to use right now is under normal purple. If you're a bar, you have to offer food, but you don't necessarily have to sell food, if that makes any sense. So the fact that you're offering food in a bar, and I'm assuming these are alcoholic beverages that you're moving around in the cart, that I would think that they would need to have even an appetizer menu or something where they could order food would be required. They don't necessarily, they don't have to, and I've seen businesses do this. They say, if you come in and order a drink, you have to order food. That's not the state's requirement. You're welcome to make that your own policy. But again, the idea is we don't want people staying longer than they need to be in small groups. And so if you use that in your analysis of what am I trying to accomplish here? Am I trying to just serve people that are sitting out by a pool that are social distance versus trying to deal with exercise in a parking lot?
Terrific. Are people allowed to go out sailing on the bay during stay-at-home order?
Yes, we have no restrictions that I'm aware of about being on the bay or being out in that type of exercise environment.
And I remember watching Governor Newsom's press conference when this was rolled out, and he went at lengths to talk about it's okay to be hiking outdoors, okay to be on the beach, where that was different from the previous order, correct?
I think so. Previous order, in theory, unless you had an emergency, you weren't supposed to go to the doctor's office. In this order, it specifically allows you to do things like grocery shopping still, going to your normal appointments. Those are still essential activities. So while this is really, really tight on a couple of the businesses, this is actually a little bit really less of an enforcement than the last one, but not much.
So going back to the hotel stay, is there so this came from a revenue management. Hello, Rafiq, glad you could join us. What do you do with pre-existing reservations? And I believe, if I can extrapolate, is there a requirement to communicate back to them? Probably a nice gesture to inform them of the requirements, best practice to inform them. But as far as a formal requirement,
I read this order as that it becomes in effect tonight at 11:59. That would be for new reservations, not existing reservations. And so, just what you said, John, I think it's a good business practice to let those folks know that are coming in that have already got a reservation, but I think the new requirements for reservations don't start until midnight tonight.
Terrific. We've had questions about anonymous complaints, especially one in which an employee felt the boss was not following mask regulations in the office.
I get a lot. I would say at least 40 to 50% of our complaints are anonymous. I was teasing John yesterday, unless Billy Joel's in town, because I got a lot of music complaints where Billy Joel was the reporting party. So I get a lot of anonymous. I get a lot of folks that just give first names. We don't share ever who reported it. At the same time, we want to be aware that somebody, if I don't get along with my next door business, I could sit all night and just file complaints. Initially, when our group started up, we were going to issue a warning letter as soon as we got the online complaint. Automatically, the letter was going to go out. And after day 2, we realized that neighborhoods were picking on businesses they didn't care for. I call it the next door syndrome, where you get everybody spun up on next door. Next thing you know, everybody's online complaining about one business, and I have 50 complaints in one day. So what we decided to do was we were not going to just send letters out. We're going to go in the field, and that changed our business model a lot, because we weren't anticipating going to 800 businesses in the last 2 months. So that's what we do. We go first. We try to verify the complaint, and then we go, if it's an employee, it may not be an employee, it may be a friend of an employee. We tell them exactly what the complaint is the best we can without disclosing who's reporting it. But the anonymous complaints are definitely high, and we take that in mind. We do not do any enforcement action unless it's something we have witnessed ourselves. That's why of the 800 businesses, we've only issued 5 citations.
Yeah. And like all things, the intention of the system is admirable. Unfortunate that your team would be spending time on some petty dispute between 2 business owners, and I hope people wouldn't take it to that. But as you said, we have this next door syndrome.
Yes.
A question here: are doctor's appointments or other medical treatment considered essential?
Yes.
Especially if the hotel is near the hospital.
Oh, in all circumstances. Yes, those are essential, and it's specifically spelled out in the stay-at-home order.
Yes, and that
was grocery shopping.
Yeah, and those the doctor medical was a key difference, right? In the early order, there was a lot of suspension of medical services. So from your vantage point and experience, and it's funny when you commented in our marketing material, we talk about the county being 470 square miles. So it's a big footprint, and to get to the 750 some businesses, that's a lot of driving. What would be 2, 3, 4 key takeaways of improvements that, from what you've seen thus far, folks could take a quick inventory and possibly let you focus on other things?
One that would really help, when the pandemic first started, I think all businesses were really good about screening their employees or having some procedure in place, because we were all required to have that procedure in place. Some have gone to, everybody's fever gets taken, it gets written down. I would be worried in this particular case, if you're a hotel, I would be more worried about OSHA than I would be about Wayne. And so or our team, OSHA is starting to look at some of these things, especially if there's an outbreak within a business, as to what preventions is being done by the business. I would suggest that we retighten up on what we were doing 6-8 months ago, and really make sure that our employees understand not to come to work if they're sick. And also when they get there, to have some procedure that they go through, whether they take their temperature and write temperature within normal limits. They don't have to write down what the temperature is, just within normal limits. And then the business keep those logs in case OSHA comes a calling. And I have seen that happen a couple of times now with some of the businesses that have had big breakouts, and the complaint didn't come to us; it went to OSHA, and OSHA was the first line investigator. The other thing that would really be helpful, and I think Dr. Morrow puts it best: if we could just get people to stop moving around just for a little bit, and not being in these large groups. So if you're running a business and you're starting to see people that are congregating in larger groups, please ask them to and I've seen that a number of times where the proprietor just says, hey folks, you've got 8 people at a table, our max is 6. I can split you up on 2 tables. Any little bit like that definitely helps. And then the third thing is masks. Masks by the employees. And I've got 2 folks on my team that are out with COVID-19 right now. And so they have no idea. They've been in all these businesses. Just wear the masks and make sure that everybody, especially your employees, are wearing those masks. I think they're crucial to us getting through this.
Well, and I believe we were both on the same call yesterday where Dr. Murrow spoke, and gosh, I wish I had $1 for each time he said, don't mix, don't go out if you don't have to. Don't mix with other families, no large gatherings, face covering, distance, wash hands.
Yes.
We would hope that everyone would, it sounds pretty simple, but it does require the business owner, unfortunately, at times to have that more difficult conversation, that reminder. Maybe perhaps because we are in the business, it's a little more top of mind with us, but some folks do need that reminder and encouragement.
Well, sure, you're in the hospitality business, so that's understandable. You want to make people's times enjoyable, and they want to come and relax. So we totally understand that, and we try to take that into consideration. We just don't want more people being sick.
Well, I'm glad you brought up the Cal OSHA requirements. We did a webinar about a month ago with a Cal OSHA expert. So along with the notes that go out for this meeting, we'll put the link for that recording. That's a whole migraine headache unto itself, parsing through Cal OSHA. And I get it. They need to make the environment safe, but the short version of this is a outbreak is considered 3 COVID cases in the workplace. And then there's, for folks who haven't watched that webinar yet or aren't in the loop, there are very specific requirements if you reach that threshold as far as reporting. And there is one item within that, I don't know if you're at liberty to opine on it, that Cal OSHA requires the business to report to the county, but the county has pretty much said, don't report to us, we'll come back to you through contact tracing. And I know I've had a few members say, gosh, I could be out of compliance here, but I don't know what to do.
And if you think you're out of compliance and you just would like us to come and either talk to you on the phone about what you're doing and whether it makes sense for your type of business, or if you'd like to have one of our folks come out, I promise you, if we come out because you asked us to come out, I'm not going to leave you with a citation. We're going to help your business get to yes. And so you've got my email down here. Don't hesitate. If you'd like us to come, if you could all not do it tomorrow, that'd be great. But if you'd like us to come out, I will certainly put you in our system and get one of our folks out. I'm also happy to talk to you on the phone and answer any of your unit specific questions, because I don't have all the answers. I've been doing this since October, but I'm learning quickly.
Yeah. And thank you for that generous offer. One more question related to reservations. Just to confirm what Mr. Haas said, The restriction is applicable to new reservations, not existing ones. Does this mean that all reservations that are already in our system before this takes effect can be honored?
That is my understanding of what I've been reading. However, I will bring you back a formal answer today through John to send back out to you. But I believe that if I'm reading that, if I was a business, that's exactly how I would read it. The state changes the rules every couple of days, so they're hard to stay up on. So I literally read it for what the text says, and I believe that that's indeed what the text says.
Yeah, and I did reach out to one of our partners who I recall during the first round of shutdown developed some really good language that was added to the registration card. So when we get that, we will reshare it because like most inboxes, email inboxes, I lost that one, but we'll pass that on as well.
And I'll definitely have an answer to you by the end of the day. I've got a 3:30 meeting with my team and the health department so that we can be on the same page. So it'll be after that 3:30 meeting today that I'm going to give you the official answer of the County of San Mateo.
Well, terrific. And Wayne, thank you so much for being with us, and can't stress enough that your department is a resource, not a punitive citation writing department, and we really appreciate you. I think you've extended with that last offer to go a little above and beyond in a big way to our members who just want to get a separate set of eyes on things. We really appreciate it. We wish your team members a speedy recovery from COVID, and happy holidays and safe holidays to you and yours.
Thank you. Happy holidays to you all. And thank you so much for having us. And again, I'll get those answers out to you today.
Thanks so much.
All right. Take care, everyone.
And for all of you on the call, we have a couple of announcements before we leave. Our 2021 our annual meeting will be done in a virtual format along with our props award ceremony. The deadline for nominations was yesterday. If you send it to us this morning, this afternoon, I think we'll still make it to inclusion, and you can send that to nova@visitsmcsv.com. Please put a placeholder in your calendar for February 17th, 2021 at 11 a.m. For the awards ceremony and annual meeting, which will again be done virtually. And lastly, we are capturing through the San Mateo County Historical Association. They are trying to capture history as it's being made, and we hope that there's no future pandemic for other generations, but they want to capture it and have it on hand. I know the president, CEO, who was our chair, Mitch Postal, has done a lot of writing about the current pandemic based on information that was captured during that Spanish flu episode of 1918, 1919. So please visit them and share your experiences. I got a note here from Nova that we will be accepting nominations through Friday. So if you can get it in today, that's even better. But through Friday would be fine. We know everyone has a lot going on and a lot of moving parts here with the latest shelter order. And from us to you, happy holidays, our CVB team in our holiday attire and backgrounds. Be safe, be healthy. Whatever holiday you celebrate this season, may it be safe, enjoyable, socially distanced, executed appropriately, and we look forward to seeing you in the coming new year. Thank you all. Be well, be safe, and we hope to see you soon again. Have a nice afternoon. Bye-bye.